So just a quick introduction. My name is Calvin Bagley. I work at the Medicare store, own the Medicare store actually, and I have one agent with me today here. Chuck also works at the Medicare store, so if you have questions afterwards, you can come to Chuck or to myself to ask those questions. We're here to provide you education and to answer any questions that you may have. Today's presentation is about original Medicare and about how Medicare works and some of your options with Medicare. This is not a presentation where we talk about insurance options per se. We're not going to go into details about insurance coverages or costs of insurance that go with Medicare. This is more about how Medicare, original, traditional Medicare functions, how it works. Okay? So this Medicare sounds so boring, doesn't it? Let me tell you something. I could talk about Medicare all day. So they limited me to 50 minutes. They said you can only talk for 50 minutes. They need to answer some questions because I'm one of those crazy people that I studied all the little details and how all the different little things work. And so today I'm going to show you some of that. And I literally could talk all day about Medicare. So I'm a little bit crazy that way. So I am a licensed insurance agent. That's how I got started understanding Medicare, with a specialty in helping people understand Medicare and their options. So that's who I am. All right, so top questions that you'll probably ask: who's eligible for Medicare? What are my coverage options? When can I enroll? What are my steps, and et cetera? How can I save money? And that's what we're going to go through in this presentation. You also have a book that says Getting Started with Medicare. You will see that this is put out by United Healthcare. They are one of the insurance companies that has a lot of Medicare plans. And so as an agent for United Healthcare and for other companies, I really enjoy their material, so that's why I'm using their material today. So as we go through this, you'll see that some of the things in the presentation are in the book, some are not, but the book is a really nice summary that you can take with you. Okay? So let's start off with who is eligible for Medicare. Now, most people understand and know that Medicare starts at age 65. There are other people that are eligible for Medicare through disability, or for certain instances like special situations with end-stage renal disease or ALS, known as Lou Gehrig's disease. So most people receive Medicare by turning 65. Now when you turn 65, if you have enrolled in Social Security, then this beautiful card comes in the mail. It's called the original Medicare card. And you'll see that it'll have your name on it and your Medicare claim number and the effective date of your Medicare. And on the back it'll have a place where you can sign the card. If you don't want Medicare, you sign the back and send it back. If you want Medicare, you sign the front and you keep it. Now, what are your coverage options when it comes to Medicare? There are parts A, B, C, and D. We try to keep it simple with all the letters. Although, there are also supplements A through N. So just when we thought it was simple, we're going to confuse you a little bit. So people ask me, why is it so complicated? And I said, well, you know, they say that as you get older, if you work on puzzles, it keeps your mind fresh. So Medicare has been designed like a puzzle. So if you study this, you'll push off other brain disease and Alzheimer's and everything else. So parts, let's go through the different parts. A and B are what come from the government. Original Medicare, A and B, often is called government Medicare or original Medicare. Some people call it fee-for-service Medicare, but this is the Medicare that comes from the government. A is to cover your hospital insurance, cover a hospital stay. Now, a lot of people think that a hospital stay means it's going to cover everything that happens in the hospital. Unfortunately, that is not the case. This is to cover the hospital. The hospital, the nursing staff, the bed, the wonderful food that you are provided, all of that is covered under Part A. It also covers inpatient mental health care, skilled nursing, hospice care, and blood infusion. These things are covered under the Part A of Medicare. Now, the few things for you to know about Part A. Well, most people don't pay premiums for Part A. You qualify for Part A because you work at least 10 years, or what we call 40 quarters, throughout your life. Or your spouse or someone that you are married to has worked the 40 quarters in their life. And that's how you qualify for Part A. And you do not typically have a premium. Those who have premiums for Part A are people who do not have the 40 quarters worked. So if you don't have the time worked or your spouse doesn't have the time worked, then you may have to pay for Part A. Now, when you go into the hospital under Part A, there is a deductible. And you pay that deductible upon admission, and that covers the first 60 days in the hospital. Again, the hospital, the bed, the staff, etc. As far as enrollment, you cannot be turned down because of pre-existing conditions. So when you turn 65 or otherwise qualify for Medicare, you're going to have this coverage regardless of pre-existing conditions. The coverage, after 60 days in the hospital, you can begin to pay a daily rate in the hospital for each day that you stay beyond 60 days. And there are other costs and things that we'll discuss as we go through this. So Part B, a few quick facts about Part B. Part B is pretty much all the things that you think of as insurance, standard insurance. Going to a doctor, standard health care, going to a doctor, having a test, having a treatment of some kind, or a cancer treatment, or any sort of a surgery. All those things fall under Part B. Part B, as it says here, also covers ambulance, laboratory services, durable medical equipment like wheelchairs, and some preventive care. What are the costs for Part B? Well, first, Part B has a premium. Some people may qualify so they don't have to pay that premium based on lower income. They may receive some sort of a subsidy that covers that premium for them. Right now, if you were already on Medicare at the start of last year, then you're paying $104.90. If you're new to Medicare and coming on, you're paying $121.80. People who are coming on today are paying higher price than those who had it last year. The reason for that is Medicare had an increase last year, but for those of you who are on Social Security did not have a cost of living increase. So there's a little rule that says if Social Security cost of living does not go up, then they cannot raise your Medicare. Isn't that nice?
Yeah.
Well, next year when Medicare goes up and your cost of living goes up, then you'll probably get a double whammy. But right now, those who are already on it are paying the $104.90, and the new people who are joining are paying slightly more. Now, the coverage with Part B is an 80-20. The government pays 80% of the Medicare allowable charges, and you pay 20% of Medicare allowable charges. Now, I like that term because it means not what the doctor or clinic perhaps bills for that, but what Medicare allows to be paid for that. So if the doctor or clinic accepts you as a patient, and they say, well, this is going to cost $10,000, but Medicare says, no, we only pay $1,000 for that service, who's on the hook for the $9,000? You are not. Isn't that great news? The doctor cannot charge it. They can only charge what is billable under Medicare. So that other $9,000 has to go away, and Medicare pays $800 and you pay $200. Does that make sense? So it's not based on the sticker price. I met the Cleveland Clinic today, and so perhaps it's not appropriate for me to say these things this way. I'm used to saying things a certain way, and I think, well, you know, I'm a guest at the Cleveland Clinic. It's interesting in healthcare, I find that sometimes the cash price is the most expensive price. Have you ever noticed that? Everywhere else cash is king, but sometimes cash pays the most expensive because Medicare has set allowable amounts that are billable for different services. And insurance companies have negotiated contracts with the providers that lower the cost of the service. So in healthcare, it's the one place where cash is not king. Very interestingly. That's a side note. I get caught on these sandbars because I got to find ways to keep this interesting after 8 years of explaining this. So when can you enroll in Part B? Well, enrollment. You cannot be turned down for pre-existing conditions, and the coverage is throughout the U.S. And generally not outside of the country. All right, let's move ahead and talk about what is not covered. Well, under Part A and B, there are certain deductibles, there are co-insurance and co-payments and premiums that you must pay. There's also something known as an excess charge, which I will explain. And there is not prescription drug coverage. And there is no benefit for standard hearing and dental coverage. These things are not covered by Medicare. Now, you may have an insurance plan that partners with Medicare that may provide some of those different coverages, but they're not covered under original Medicare. I do want to take one moment and just explain what a Part B excess charge is. An excess charge means that a doctor may charge you more than what is allowed under Medicare, but it's limited. So go back to that example that I gave you. Say there's a $10,000 service, but Medicare says we only pay $1,000 for that. And you have come to the Cleveland Clinic or to the Mayo Clinic in Scottsdale, Arizona, for example, and you receive that service. Well, if that doctor charges an excess charge, then you could pay 15% more, and it's capped at 15%, 15% more than that 20% you would normally pay. So they still cannot bill you for the $9,000 that Medicare didn't pay, but they could bill you for an extra 15% over what Medicare did pay. So if Medicare paid $1,000, says this is a $1,000 service, they could bill you an extra $150, 15%. But they can't bill you that $9,000. They can bill you an extra 15%. That is the cap of an excess charge. Any doctor that accepts you as a patient under Medicare is capped at charging you that extra 15%, even if they haven't signed Medicare's contract. We call this assignment. So some doctors have accepted Medicare assignment, and they're capped at what Medicare pays. Some doctors have not accepted assignment, and they are capped at 15% above what Medicare pays. So even those doctors who don't accept Medicare, as you may accept assignment, are capped at charging you 15% above Medicare. Isn't that nice to know? It's very nice to know. We have a question.
There's a question.
Yes, please.
Is it okay, is it not kosher to ask a doctor or a provider ahead of time, would you accept assignment? I remember years back when I worked in a hospital that it wasn't a good idea to come right out and ask that initially. But another way of looking at it, it makes a lot of sense to know in advance. Is it okay to?
The question is it okay to ask the doctor ahead of time, do you accept assignment, or am I going to be responsible for that 15% excess charge? Yes, in my view, it's absolutely acceptable. But what I have found through years of experience here in Las Vegas is that the patient doesn't know most of the time when an excess charge is going to be charged, because oftentimes they occur in a hospital under a situation of duress. So for example, let's say you're rushed into the hospital with a heart attack. Are you going to say, now wait a minute, before you save my life, am I going to be on the hook for an extra 15% here? No, you're going to receive all those services. And I'll tell you a quick story. And I say this in jest, but it was a very serious situation. I had a client of mine who I had helped with insurance, and she did not have coverage for the excess charges. She went into the hospital and she thought she was going to die. And her life was saved. She went home and got the bill and wished she was dead. And she said, Calvin, this doesn't cover excess charges. So most of the time when excess charges occur, it's in a situation where you just don't have a choice. You know, if you're going to see your eye doctor to have surgery done, yeah, ask them about the excess charges and make sure that you have coverage for that or what have you. But in an emergency situation, perhaps you should think in advance, do I have coverage for excess charges if that's a concern of yours? Does that help? Another question.
Did you say 15% is the cap on
That's
the
the cap.
excess?
Yes, it is.
Okay, thank you.
15%. So it can't be unlimited.
Okay.
But if you only have Medicare, nothing else with it, then you have to think, I could be responsible for 35% of the bill instead of just 20%, because you could have that extra 15% on there. Does that make sense? So excess charges don't happen all over the place, but your premier clinics and premier doctors, they usually charge excess charges because they're very well known, they're very well established, and they deserve it. So if you're going to go to the Cleveland Clinic or you're going to go to the Mayo Clinic, usually upon entrance you'll sit down with the counselor and they'll discuss this with you and say, okay, if you don't have coverage for the excess charges, we want you to know that we charge those here because we're a premier clinic. So,
Quick question.
Yes.
Are you going to discuss the coverage for excess charges? Is that part of the...
I am going to high level discuss that. Again, this is not that would be more along a sales presentation style of a plan, and I'm not allowed to go into any sort of details, but I will tell you that there are plans that cover excess charges, and we will hit that at a high level today.
Okay.
Like Medicare supplements, most people have heard of the Plan
So
F and the Plan G supplement. Those are supplements that cover excess charges. Medicare Advantage plans, which we haven't gotten to yet, they're not allowed to charge excess charges. So it's more of a concern if you're just on original Medicare or if you don't have a supplement that covers it. Okay, but I'm almost done. I mean, I still have 60 slides in here, but that's pretty much it. Medicare Advantage plans, Part C. So remember I said there's A, B, C, and D. A and B are from the government. C and D are from insurance companies. Now, even though they're from insurance companies, they still are Medicare. Think of it like private Medicare, privatized Medicare. They are Medicare through, they have to get contracts, they have to meet requirements that the government sets forth in order to offer these plans. So C is Medicare Advantage. How many of you have heard of United Healthcare, Humana, Senior Dimensions, Aetna, CareMore? Those are Medicare Advantage plans. And they are more like traditional insurance that you had when you were working. They have networks like an HMO and a PPO. You must use their doctors. And PPO may have in or out of network. HMO has, you have a primary care doctor and you have referrals to specialists. These plans are privatized Medicare plans offered by insurance companies. So in essence, you replace your A and B with a C plan. Well, I say replace, but it's more like it's a combo. Think of it like going to a fast food restaurant and saying, give me a combo number 1. It's going to have your hospital coverage, your doctor coverage, and your drug coverage, D, all together in this combo plan. Okay? So, some facts about Medicare Advantage. It combines Part A and B together. It has prescription drug coverage usually. Some plans are without, but usually here, especially in Las Vegas, all of our plans have drug coverage that are Part C plans. They're offered by private insurance companies like United Healthcare, and often they throw in extra benefits to entice and persuade people to join their plan, like hearing coverage, dental coverage, etc. All right? Now, to be eligible for Part C, you have to be enrolled in A and B. And then you can consider joining a C plan, a Part C plan. Now, I'm calling Part C. All of your friends will call them either Medicare Advantage, if they're savvy, or they'll just tell you that they have one of the company's names, like Humana, United, Senior Dimensions, CareMore, Aetna. They'll say the name, and you'll know, okay, I understand that's one of these combo plans where I have to go to the doctors that accept that plan. All right? Now, in exchange for doing that, oftentimes they have different copays that may be advantageous. Maybe it costs less to see a doctor, it costs less to go to a hospital. Depends on the plan, and that's really how they have become successful, is they offer this coverage that's financially beyond what Medicare offers, but you're giving up your freedom to go to doctors anywhere, anytime. Does that make sense? Okay. Now, you cannot have end-stage renal disease and get a C plan. That's the one health condition that they can preclude you from joining their plans. Here in Las Vegas, we do have one plan that is specifically designed for people with end-stage renal disease, that it's a Part C plan, but that's the only plan that you can join. So people ask me a lot of times, well, why is that? I don't really know the reason, except that when Medicare was established in the beginning, end-stage renal disease is one of the conditions for which you can receive Medicare at any age. So if you're 40 years old and you have end-stage renal disease, you can go on to Medicare without waiting. However, you can't join this extra C plan. All right. And if anyone has a question throughout, please, I'm willing to answer any questions. Yes?
Yeah, with the Advantage plan, they don't really give you a Medicare card, do they?
The question is, with an Advantage plan, do you receive a Medicare card? And thank you for that question. Yes, you still receive a Medicare card, but you don't use it at the doctor's office. So you take your Medicare card, you put it away somewhere safe, and when you go to the doctor, you use that one card for the doctor, for the hospital, at the pharmacy, kind of like you did when you had a group plan. Okay, so a few fast facts. Plan premiums can change from year to year. Every year, the plans file a new plan and tell you what it's going to be in January. And during open enrollment, you can change your plan at the end of the year. If you don't like the current plan you're on, or you want to try a different company, you can switch your plan at the end of the year if you're on a C plan. You have to keep paying your Part B premium. So what's the coverage? Well, it's that coverage of the A, B, and D all together, as I explained. Okay? There are different types of Medicare Advantage plans. There's the HMO, there are PPOs. In some other states, they have something called a PFFS, which we do not have here in Las Vegas, which we used to have, but it's kind of an interesting plan where you go to the doctor and they decide whether or not they're going to accept your plan at that point. So there's also special needs plans. Sorry, I jumped ahead. Special needs plans, and sometimes there's a health maintenance organization or HMO that has a point of service component. So let me explain those. HMO and PPO are pretty clear to people. You understand the HMO, PPO. HMO, you have a primary care doctor, you get referrals from that doctor to see specialists, and you stay within the network. PPO, you have preferred providers. You can go to any of those providers in the network, but if you go outside of that network, then you're out of network, and you do have coverage, but it's not nearly the same kind of coverage as you have within the network. The special needs plan is a plan for people with special health conditions. So for example, and here in Las Vegas, they're all HMOs. An HMO with a special needs component. If you have heart disease, if you have diabetes, or there are conditions that there are special plans for that condition, and they may cover the prescriptions that are necessary for that condition, or they may cover the durable medical equipment that you need for that condition at a higher level than another HMO plan. So that's what a special needs plan is. And then the HMO POS means you have an HMO plan where you have to stay within the network, but you have a limited benefit that allows you to go out of the network and spend usually a few hundred or a few $1,000s outside of the network. Certainly not enough coverage to get surgery or something like that, but it allows you to go and get a second opinion if one is necessary outside of your HMO network. So those are the available Part C plans here in Las Vegas, mostly HMO, PPO, and special needs plans. Okay, let's leave that for a minute and let's talk about prescription drug coverage. Part D. This one's the easy one. Everyone knows Part D because D is for drugs, right? So prescription drugs plans are only offered through insurance companies. Currently, if you want a prescription drug plan only here in Las Vegas, there are 27 options for you. They are offered by all kinds of insurance companies, and what we do as insurance agents is we help you figure out which one would work best based on our assessment of what you're currently taking. But they're not, a D plan is not available from the government. They're all offered through these subsidized programs through insurance companies. So the costs vary from plan to plan, although there is a standard outline that we'll go over here and show you kind of how the standard outline works. But the benefits are based on the formulary and the tiers and where everything falls within the formulary, which I'll explain that more as we get into the Part D.
I'm from Elko. I have a question.
Yes, please.
If you are eligible at 65 for Medicare, but you or your spouse are still working and you have insurance through your employer, will you be penalized later on? Let's say for 5 years later, your spouse retires or you retire. Are you penalized for the back pay to 65?
Thank you for that question. What was your name?
Tammy?
Tammy from Elko. Yes, thank you for that question. If you are working and you have coverage through your employer and you wish to keep that coverage, you may keep that coverage. You don't have to drop your group plan through work and join Medicare at 65. You can keep that coverage. Now, what we find is sometimes it's advantageous to keep that coverage. Sometimes it's advantageous to go to Medicare. It depends on your situation. But if you wait and let's say you join Medicare at 68 because you've stayed on that group plan, you will not be penalized. You will not be penalized for not having Medicare when you turn 65, and as long as the coverage that you have through your work is considered creditable coverage. Does that answer your question?
What if you're covered by your spouse, not yourself?
That is also permitted, as long as it is employer coverage. That is not permitted when it is an individual plan or a family plan. but it is permitted on employer coverage.
Then you should fight it. Thank you.
You're welcome, thank you. All right, so, yes, one more question, please.
It's, this brings up hers. But why would you not want to sign up for Medicare Part A, which is free while you're working?
Thank you. Most people will take A, but refuse B when they're working.
Because then you could add B later.
Then you can add B at any time.
When you sign up for A.
So the question is, why wouldn't you keep A? And the answer, why wouldn't you take A if you have group coverage? The answer is yes, most people will take A. They'll just refuse B because A is free and B has a premium, and then they'll take B later. And there is no time frame. You can sign up for B anytime you want when you have group coverage. So you don't have to wait for open enrollment or anything. It could be the middle of the year, and you say, okay, now I'm ready to drop my group plan and go with A and B, and you can sign up for B at that time. Thank you for that question. Yes.
Yes, I know a couple of people. One was a state worker that he said if he didn't, they sent him a notice that if he didn't sign up for Medicare, that they would drop his medical coverage. And I know another lady who they did drop her medical coverage. It was through her husband's employment. He was deceased. She was a survivor, and they dropped her medical coverage because she didn't sign up.
So the question is, some employer plans, like the state and others, have said you must sign up for Medicare or else we won't cover you on our group plan. And that is true and it is allowed. They can't, and employers don't have to offer coverage to retirees. They can say your coverage is now Medicare. So it's very important. This is very, very important. And I'm glad that these questions have come out because I didn't really address this. Very important that if you are turning 65 and you have group coverage, you speak to your benefits administrator, because you can't assume that that coverage is going to continue. You also can't assume that they want or don't require that you sign up for Medicare. So it is very important that you speak to your group administrator, your benefits administrator, your employer, when you're turning 65. So thank you for that. Okay, so let's go back to Part D, prescription drug plans. Most drug plans will have a tiered formulary that looks something like this, tiers 1 through 5. They can have different tiers, and sometimes people will say to me, I have a tier 4 drug. Well, that may be tier 4 in the insurance company you are with right now, but every insurance company sets their own tiers. So it's something that's considered tier 4 for one company may not be tier 4 for the next company. But most of the time, the tiers are set like this. Tier 1 is the least expensive to tier 5, the most expensive. But it varies by company. So now we must talk about the most dreaded of all things in Medicare, known as the donut hole or coverage gap. How many of you have heard about the donut hole? Yes. Okay. So how many of you have hit the donut hole before? We have some experience here. We're not talking about yummy, treats that are fried in oil or anything like that, or the hole in the middle. We are talking about an area within prescription drug coverage where your coverage is not as good as it was earlier in the year. So let me explain. At the beginning of the year, you start out with this initial coverage, which means your insurance for prescription drugs is going to cover up to $3,310. Now, let me take one step back because I got ahead of myself. Prior to that, some drug plans will have a deductible. So they're allowed to have a deductible. The deductible is capped. So, it can only be, I think it's $310, no, it's $400 this year. Don't quote me on that. I don't have that in my head, but it's capped at about $400, okay? After that deductible, if your plan has one, you go into the initial coverage phase. As you spend more money on drugs, you move through these 3 phases. For those of you who perhaps provide care to people on Medicare, and for those of you who know or have experienced this, you'll see that when people turn 65, a lot of times they transition from their more expensive medication to generic medications. The reason for the transition is because of the donut hole. Because if your prescriptions are lower cost, like with generics, then you don't have to worry about the donut hole because you don't spend more than $3,310 in a year. Now let me explain what that $3,310 is. That is what you and the insurance company together have spent on your medications. So it's the retail cost of your drugs. So I showed you the tiers at the first, that you may be taking, let's say you're taking a tier 3 drug, and you're paying $45 a month when you go to the pharmacy to fill that drug. So you say, well, at $45 a month, it's going to take a long time to get to $3,000. Unfortunately, that's not the case, because that drug might cost $1,000. You're only paying $45, but if that drug costs $1,000, you're going to spend $3,300 in 3 months and a third. So you get to the 4th month and you go to the pharmacy and you're skipping to the pharmacy. I'm going to get my expensive medication for $45, and they say, I'm sorry, you're now in the gap. And so your cost is now going up. And when you're in the gap, you pay a percentage of the drug. The percentage is different for brand names and generics, but you're going to pay about half the price of a brand name drug. So all of a sudden, that $1,000 medication that was costing you $45 a month now costs $500, because it's a percentage of the retail cost. Well, how long do you have to do that? You have to do that until you spend $4,850. Now remember that the $3,310 was the retail cost. Unfortunately, the $4,850 is what you spend. Now, what you have spent in the beginning of the year counts towards it, and then you have to spend that money until you get out of it. Once you get out of it, you get to catastrophic coverage, and your price drops way down. For brand names, it drops down to 5%. So your $1,000 medication would now cost $50. Then January comes, and you start all over at the beginning with the deductible, the initial coverage, potentially the coverage gap, and the catastrophic coverage. So this one is a real tricky one. If at all possible, and when you're on Medicare, if at all possible, you want to use generics to stay awake, to stay clear of that expensive cost. Now, there are some programs that will help with this, but not insurance. This is the insurance plan. Without this, you would be paying full cost for all of your drugs. So this is the insurance plan. If these costs become too much and your income helps you qualify for help, here in the state of Nevada, we have a wonderful program called State Pharmaceutical Assistance, that if most people who are living on Social Security alone can qualify for state pharmaceutical assistance, and it will cover the gap for you, and a few other things. State Pharmaceutical Assistance. It's called the State Pharmaceutical Assistance Program, often referred to as SPAP in industry speak, but the State Pharmaceutical Assistance Program, or SPAP, is offered by the state of Nevada for people, generally, if you're, these are loose, you need to apply for it if you qualify, but there's some loose guidelines for you. Say an individual who's making $2,000 a month, $2,000 or less, probably qualifies. A couple, married couple, making $3,300 or so or less, probably will qualify, and they should apply for state pharmaceutical assistance. Now, if the income is considerably less than that, then there are more programs. There are federal programs called Extra Help, and there's also state Medicaid program. So there are other programs to help with this based on income. But if the income is above that, then there isn't extra insurance to cover the donut hole. We have a question.
This $4,850, is there a bottom to that? Does it start at the $3,310?
It starts at the question is the $4,850, where does it start?
Right.
You start accumulating to that at the beginning of the year. So if you go in January and you pay $45 for your prescription, right, that counts towards the $4,850. Everything you've spent throughout the year counts towards it. You just don't experience the coverage gap until you have passed the initial coverage.
$3,310 in some way doesn't get subtracted from that?
The question is, does the $3,310 get subtracted from the $4,850? The answer is only the part of the $3,310 that you spent counts towards that. So if you spent let's make it easy. Let's say in the $3,310 you spent $850, and now you go in the donut hole, you have $4,000 left. The portion that you have spent. The portion that you have spent yourself.
Oh.
So the $3,310 is the retail cost of your drugs. The $48.50 is your out-of-pocket for the year. How much you have spent out of your pocket for the year. We have another question.
Differ by the supplemental plan that you purchased?
So the
What this 33 and 48 is, or is this consistent across?
So the question is, does this differ by the plan that you purchased, the insurance that you purchased? The answer is no, it does not differ. These stages are federal design. And actually the beneficiary receives a statement in the mail telling them how close they're getting to the coverage gap or the donut hole, or how much has been spent in their behalf, and it's tracked by CMS, which is Centers for Medicare and Medicaid Services. It's tracked by Medicare. So someone who gets into the donut hole, oftentimes they'll call an insurance agent and say, help, I need to switch to another insurance company. It won't help. Because you could be on with one insurance company and switch to another, and it doesn't change where you're at in the process because it's tracked by the government.
Since it's government regulated, would these figures have changed because of Obamacare?
The question is, have these figures changed because of Obamacare? Yes, actually Obamacare had a positive effect to this particular component of Medicare. The coverage gap is getting slightly smaller, and by 2020 it'll be much, much smaller than it is now. The coverage will be greater. I say it'll be smaller. In my simple mind, I think, can't they just squeeze it together? But I'm not a politician because I have a simple mind. And so it's more like they're going to squeeze it a little bit. They're going to fill the trough a little bit. It's a combination of a lot of different things, but the coverage is getting better each year until 2020. Not to be political, there were some things that Obamacare damaged in Medicare. There were some things that it helped. This is one of the things that it helped. Overall, Obamacare doesn't have a large impact to Medicare, overall. Okay, this is a very complicated piece. If you understand this, and if you understand the difference between a Medicare supplement and a Medicare Advantage plan, and you understand the phases of drug coverage, then you can go home and talk to your neighbors and you're already smarter than about Medicare. I'm telling you, this is the crude in Medicare. These things, and they're complicated. And you can see we're on slide 23. So let's see, I've got 5 more minutes to go through the next 60 slides. I've been telling you all about it as we've gone, but I need to get to a couple of really important things here before we wrap and I go to questions. We've talked about Medicare Advantage plans. We need to talk about Medicare Supplement plans. Medicare Supplement, I said Medicare Advantage was like a combo plan. Medicare Supplement is like a la carte. So on a Medicare Supplement, you're going to keep Medicare as your primary insurance, which allows you to go to any doctor that takes Medicare. You're going to purchase a secondary policy that covers the things that Medicare doesn't. Then you're going to have a third policy that covers your prescription drug plan. So remember, to keep this simple, I said that if you have a Medicare Advantage plan, you have one card, and you take that card everywhere you go, and you show that card. And you go to the doctors that take that card, you go to the pharmacies that accept that card, you go to the hospitals that accept that card, right? You're in a network, just like you probably are with your group plan. With a Medicare Supplement, you carry 3 cards in your wallet. When you go to a doctor, you give them your Medicare card as your primary insurance. You give them your supplement card as your secondary insurance. When you go to a pharmacy, you keep both of those in your wallet or purse, and you give them your prescription drug card for prescription drug coverage. So sometimes if you can visualize that, it helps you see the difference between the 2 plans. So Medicare, what it covers, right here it says, it helps cover some of what Medicare Parts A and B don't. For the most part, it is a mirror to Medicare. So if Medicare says, we don't cover dentures, which they don't, will your supplement pick up and cover dentures? No. What the supplement does is it helps cover the costs of Medicare. So if you go to a doctor and the doctor says, or bills everything through and says, your part of this is $2,000, and you get that bill back, you owe $2,000. The supplement pays that. Now, you don't have to send bills to the supplement. It all gets billed for you through the doctor's office and through Medicare. So you should just receive a statement that says, Medicare paid $8,000, and my supplement paid $2,000, and I owe nothing. Now, because there are supplements A, B, C, D, F, G, K, L, M, and N, there are lots of different kinds of supplements. I think I have a chart in here. I don't know that I do. Okay, I don't think I have the chart in here, but essentially, I told you about excess charges. There are only 2 of those supplements that cover those excess charges. So if you're trying to narrow it down, I would look at excess charges and say, which of these plans cover excess charges? And that's the Plan F and the Plan G. So those are the more popular plans. Another thing for you to know that's kind of up and coming right now is that the Plan F is being phased out. And so in 2020, if you're new to Medicare in 2020, you won't be able to sign up for a Plan F. The highest plan will be the Plan G. But there's not a huge difference between the 2 plans when you look at it. It's not, this isn't alarming. The Plan G is still a great plan. But the Plan F is being phased out. The Plan G makes you pay the Part B deductible, which is currently $166 a year. So with a Plan G, you'll pay $166 a year, and then you'll have 100% coverage after that for Medicare expenses. So it's not doom and gloom. The reasoning for it is there's a general feeling that if the Medicare beneficiary has to pay something to see a doctor, it will deter them from using the doctor as much as they would if they don't ever have to pay anything to see a doctor. So it's called first dollar coverage, where the first time you go to a doctor, you're 100% covered. That's what a Plan F does. And it's being phased out because the feeling in the industry and in the government is if you don't have first dollar coverage, you might use the services a little bit less and therefore save money for the whole system. So this has been talked about for many, many years, and it just came about this year, and it will be phased out in 2020. So that's some industry information for you, for those of you who thought, well, I'm not going to pick up anything today. You got something, right? Okay. So this summarizes your choices. You have to enroll in A and B, and then you have the option of either taking a supplement with a drug plan, which is the a la carte version, or the prescription or the combo plan, which is the Medicare Advantage C that includes everything with it. Okay, let me see what if.
Are the supplements really expensive, or how do you get those?
The supplements are purchased through insurance companies, so you would need to see an insurance agent to discuss price. Again, this is an educational thing, so I'm not allowed to discuss price points or anything like that. But what is expensive? Expensive depends on your income, right? So if you're on a fixed income and your money's tight, then $1 might be expensive, right? So it just depends on the person. Most people find that if they're on an individual plan through Obamacare and they're going on to Medicare, they're thrilled because it's much less expensive than what they're paying now. But if they're on a group plan where everything's paid for them and they're coming onto Medicare, maybe they're not so thrilled because now they're paying more. But it's much less than a 64-year-old on Obamacare, much, much less. Yes?
Can you be on both Medicare and Medicaid?
Question is, can you be on both Medicare and Medicaid? The answer is yes. So Medicare and Medicaid, we call it Medi-Medi. Medicare and Medicaid means you have both. And when you have Medicare and Medicaid, you can join one of these types of plans. It's usually not advised, but in some cases, certainly not a Medicare supplement. You shouldn't be paying extra for that because Medicare and Medicaid coordinate and cover most things. But you must have a drug plan. So you have to have a Part D plan, although Medicaid will help you pay for it. So there are plans, like there's a Part C plan here that's specifically for people that are on Medicare and Medicaid. It's one of those special needs plans. So there are options for people on Medicare and Medicaid, but traditionally, when you're on Medicare and Medicaid, you stay with that and just get a drug plan.
Thank you.
Yep. Okay. Other questions, or should I keep rolling through a few more things here? You've been asking your questions throughout, right?
Right.
So we don't really have a buildup of questions. All right, so I'll keep going. And some of these we can go through kind of quickly because I've already explained them to you. When can I enroll? Usually for Medicare, you enroll at 65, and there's a 7-month window. The 3 months before you turn 65, the month of your 65th birthday, and the 3 months after. You should enroll in that time frame. What if you miss it? I'm not a cursing person, but I wish I could say, like, all heck breaks loose, right? It's bad. Don't miss your window. It is
What's the window
bad.
again? I'm sorry, because I have 9
Th-
months.
3 months before your birthday,
Okay.
the month of your birthday, and the 3 months after your birthday. So 3 months before you turn 65, you should be calling Social Security. Social Security is who does the enrollment for Medicare. And so you contact Social Security and discuss what you're going to do with your Medicare 3 months before. Now, if you have taken Social Security already, some people take it as early as 62. If you've taken it already, then the card just comes in the mail. You're already signed up. But if you don't see the card and you're getting closer, you better call, right? If you haven't taken Social Security, you need to enroll yourself and call and enroll. So if you miss it, then you cannot enroll again until January. Between January and March, you can enroll. And your plan, your Medicare won't start until July of next year. So right now, we're in July. Let's say you missed your window. And you call Medicare right now and say, okay, I'm ready to sign up. They say, did you have employer coverage? Nope. When did you turn 65? 4 months ago. You can't have Medicare until July of 2017. Don't miss your window, and don't let your friends miss their window. Very important. Okay. So in addition to that, when you sign up next year, you're going to have a penalty. Medicare penalties for Part B are lifetime penalties. So now you'll have a penalty that you carry with you. In addition to not having coverage for the last year, you have a penalty you'll have for your whole life. It's 10% of the premium for each year that you weren't covered. So for example here, we have this lovely lady, looks very competent, but missed this one thing. She went 3 years without coverage and didn't have a drug plan, didn't have an employer group plan, and so she has a penalty of 30%, which equals $36.54. And so her premium is $158 while everyone else is paying $121.80. What happens to her when the premium eventually goes up to $200 a month? Well, it's a percentage. So she's going to pay $260. She'll always pay 30% more than the other people. Does that make sense? So don't miss it. Not only are you without coverage for a long time, you also have a penalty.
How did they come up with that? A lifelong penalty?
Lifelong penalty.
Oh my goodness.
This is called coercion. Like, okay, I'll sign up. Yes, I will. Right? Sign up. There is a good reason for it, though. This system is based upon volume and everyone participating. If you're not participating, and then you decide to sign up when something bad happens and you're allowed to, you're going to cost the system a lot. It's not fair that you are in and you're paying and you're doing everything right and your friend or neighbor isn't, and then now all of a sudden they find they have cancer and they get full coverage on everything. So it's only right that everyone participate, and those who did participate, they pay the penalty to make up for that. But yeah, it's based on participation. So Part C and D, prescription drug plans and Medicare Advantage plans have the same window. You can sign up for an Advantage plan during that same time frame of when you sign up for Medicare. It's not in there, but I'll tell you that you can sign up for the supplement plan 6 months before and 6 months after. So the supplement window is a little bit larger. So some people choose their supplement even before they have their Medicare plan. So if you work past 65, we answered this question earlier. If you have good coverage and you've spoken with your benefits administrator, then you absolutely can keep that. You don't have to go to Medicare. It's recommended that you take the A and wait to take the B. But you want to determine that between your insurance agent and your benefits coordinator.
And
Question?
there's no 30% penalty if you pick B, like once you retire at age 70.
And the question is, are you subject to a penalty if you wait because you have employer coverage? There is no penalty if you have employer coverage through a group plan.
Or if you were to add C and D, is there a penalty?
Still no penalty for any, there'll be no penalties for C or D or anything else. You're absolutely allowed to keep that and not face any negative consequences if you keep your employer plan instead of Medicare while you're continuing with that plan. Now, the same rules, I should just put a little asterisk and caveat on this, the same rules do not apply to a retiree plan. So if you're retired and you're on a retiree plan, then that's different from working and having coverage. You see the difference? Working with coverage is different from being on a retiree plan. If you're on a retiree plan, we need to discuss what your Medicare options are, and you need to usually need to enroll in Medicare at 65. So you want to make that distinction. Okay, Medicare supplement insurance. It doesn't show the 6 months before, but it shows the month of your birthday and the 5 months after. You can sign up for insurance plan at 65. The reason this is significant is because even with all the changes that have happened with health insurance, where pre-existing conditions are not do not preclude you from getting coverage, with a Medicare supplement they still do. So Medicare supplements still can be medically underwritten, which means you're 67 years old, 68 years old, and you find out that you need to come to the Cleveland Clinic. And you say, okay, I'm going to call Calvin and say, Calvin, I need that supplement now. Well, unfortunately, I'm going to have to tell you, no, we can try, but you may be declined because now you have a pre-existing health condition. So that's why this is important, because that first 6 months, you could choose to sign up for one of those supplements. If you want to go the a la carte option, you can join one of those supplements and they can't ask any health questions. That may be the only time in your life that you have that ability.
And that's the first 6 months after your employer coverage ended?
It also, the question is, does that work when your employer coverage ends? Yes. So we're talking a lot about turning 65, but I want to stress that turning 65 or your Part B starting, those we treat those as the same type of event. So either you turn 65 and take coverage and you get your 6 month window, or you're 69 years old and you take Part B and now you get a 6 month window. So those who keep employer coverage, they get the same benefit. It just happens later when their employer coverage ends and their Part B starts. This is all these little here's my asterisk. I've been doing a lot of those now. The asterisk is, if you take Part B and have employer coverage, then your 6 month window starts now. So when you drop your employer coverage, you don't get another 6 month window because you took Part B already. You follow me on that? It's a very important distinction. Okay, so what are my next steps? Well, review the things we've talked today. Meet with someone who can discuss and explain these things to you if you have questions. Ask your questions, get answer, enroll, and then every year do a review of your insurance. The reason that number 7 I want to stress is these plans, the supplement plans, are very consistent. The only thing that really changes with the supplement plan is how much you're paying, but the coverage is consistent. So you may want to review your premium and say, hey, I'm still in good health. Maybe I want to switch to another company. You can do that if you can answer the health questions. But the drug plan and the Advantage plans, you really need to review those on an annual basis. Because open enrollment from October 15th through December 7th, they make changes for the next year. And if you're not aware of those changes, you may be the one person who is taking that prescription that's not going to be covered next year on your plan. So you need to review your plan each year for your drug plan, and you need to review your Medicare Advantage plan. If you have a Medicare Advantage plan, you need to review those two things every year during open enrollment. Remember, keep your mind fresh, right?
With whom do you review? With the supplier of the...
Okay, so the question is, who do you review that information with? There are lots of options. Let me tell you some of the people that can assist you. Obviously, we're an insurance agency, and so we can review those things with you. There are also state programs and state people that can assist you with that. Every state in the state of Nevada, we have SHIP counselors, SHIP, which is State Health Insurance Program. SHIP counselors are volunteers that have gone through a rigorous training to understand programs like this. They can help you review it. Medicare.gov is a resource where you can do reviews. And then your plan also will directly send you the changes of the upcoming year. And it's not too hard to read. It's only about this big. And when you go through it, you'll be able to determine what's changing. And then you decide if you want to keep your plan the next year. See? I can make fun of insurance companies too. How can I save money when I'm covered by Medicare? Stay in your network if you have a network. Find out if you qualify for extra help. If your income puts you in one of those categories. A lot of people don't think that there would be help for them, a married couple that, because Medicaid is the threshold is very, very low, I would say, income. It's under $1,000 a month, so it's very low. But that's not the only program out there. Some people think that's the only program. That is not the only program out there. So if, like I said, with the state pharmaceutical assistance, you could be a married couple making $3,000 a month, which is living off of Social Security, and many seniors are doing that, and qualify for some help with prescriptions. So speak to someone about extra help. You can do that by contacting Medicare. You can do it through Social Security. You can speak to an agent. There are many resources there. Question?
No,
comment?
I'd just like to comment on what you're saying. I'm here from the state today, and I was a Medicare trainer for years, and I'm here for MIPA today, so that's the extra help program. And if you have questions about that today afterward, I'll be glad to help you or give you an application.
Thank you. So we have, I'll repeat that for those who are in another state. We have a representative from the state here who is trained on the extra help, and that is what she does. So if you have questions or things for her, then she's available as a resource here as well. Okay, so let's see, where can I find more information? Let me go through some of this. Visit Medicare.gov, call 1-800-MEDICARE, or call your state health insurance program SHIP that I told you about, the state health insurance program. And I would add on there, an insurance agent that's knowledgeable is also a great resource for you. Okay, whew, we made it. Question?
And you were talking about the 60 days of hospitalization. Is that 60 days in a calendar year or 60 days at a time? Let's say somebody's sick in January and they're in for 60 days. Then they get sick again in August. Have they used up their 60, or is that 60 per admission?
Thank you. So the question is about Part A hospital insurance and the 60 days that are covered under that first deductible. Before I answer your question, I just want to say that 60 days is not the limit. You actually can go up to 150 days in the hospital because you have coverage up to 90 days, and then you have 60 lifetime reserve days that you can use once in a lifetime that could take you to 150. Once you use those reserve days, you're now capped at 90 days in the hospital. Bless you. So your question is, how does that work? It's based on benefit periods. So it's not 60 days in a calendar year. It's 60 days per occurrence for that deductible. So you could go into the hospital, spend 60 days in the hospital, go home, and have something else occur and come back. Now a benefit period is, it's industry speak for the same condition. So if you're going back, you've been in the hospital 60 days, you go home for a day and you come back for the same situation, you don't have coverage. But let's take let's say you go into the hospital, you have a heart attack. You're in the hospital for several days. You go home and you have a car accident on the way home. You have the worst luck I've ever heard of, right? You go back to the hospital. You just started a new benefit period because it's for a different purpose. So guess what? You have to pay the deductible again. Yep. And then you go home, and you get home, and you're so stressed out over the car accident and the heart attack, you have a stroke. You go back to the hospital. Guess what? You have to pay the deductible again. It's based, I know, everybody's knocking on wood everywhere. I think this is not even, I think it's plastic up here. The point is that it's based on the occurrence. It's based on this benefit period. So it's not an annual thing. It can be done multiple times, and I have known people that have been in the hospital 10 times in a year and have paid their deductible 10 times in a year. That's why you need to consider these other coverage options.
Let's say an event, like they fell once and then they're back a month later for another fall, and then they're back for another fall.
If it's the same event, sometimes it can be combined into the same benefit period.
Thank
Yep.
you.
So, another question?
Well, isn't the hospital, this whole readmission, they're trying to avoid the readmission, so the hospital is going to be penalized if it's the same event. Is that right?
Yeah, so hospitals are trying to keep people from being readmitted, so it's their goal not to have you readmitted for the same thing. So we're not seeing a lot of those readmittances. But that also means that the next time you go to the hospital, there is an incentive for them to show that it was for a different reason, which means you pay another deductible. So there's two sides to that answers to that sort. Well, thank you all for being here. I'll be here for any questions you may have. We appreciate your participation today and hope that was helpful.